Hello, everyone. Happy Wednesday. I am so excited and grateful for the opportunity to have here with me Dr. Christopher Phelps. Dr. Christopher, thank you so much for this opportunity to pick your brain and talk about this so important topic. And I basically want to just give people a few seconds to join us and or to test and make sure that before we dive into this conversation, we know that things are working and that you're able to hear me. So as anyone joining us, let us know. Hi, Dr. Phelps. Thank you so much for joining me today.
Hey, my pleasure. Thanks for having me.
Sure. So let me just do some troubleshooting things here before we jump into the conversation. Make sure people can hear me and see me. And oh geez. So I have like a trillion number of requests to join the group as we speak. Okay, so we have some people. Can you let me know in the comments if you're able to hear us? Okay, give us a thumbs up so that we can jump right into. I want to be respectful of Dr. Phelps' time and everyone's time as they're joining us. So let me know in the comments. Yes, it looks like okay. It sounds like we are live and people can hear us. So why did I ask Dr. Phelps to join us today? I have personally, and for those of you who don't know me, my name is Maritza Duran, and I'm the founder of Emden Consulting Services. I started my career doing clinical dentistry, and I built my way up from every position in a dental office. And over the years, I saw this common trend with really amazing clinicians, dentists that really loved what they did. They served their patients. They really cared about the integrity of the work and wanted to continue to expand, but they struggled to be able to get the patients to accept treatment and and they struggle with the bottom line of the practice. I also had the opportunity of meeting dentists that were great at communicating. They weren't necessarily the best, in terms of patients coming back and needing retreatment. And I felt that if there was something or someone that can come in and just basically take these dentists and really help them understand how to add the value that they already clinically can perform and get the patients to say yes to the treatment and add value to their families and to sustain their businesses better, what can be done? So I'm really excited and grateful for the opportunity to have Dr. Christopher Phelps. You do not need an introduction, but I am going to just share a couple of pointers of why everyone should listen and pay attention to what you have to say. First off, you're an entrepreneur. So you have been in business for multiple years. You know the ins and outs and all the pitfalls that we struggle with as business owners. You are a practicing dentist. So you go through on the day-to-day basis having to make decisions to improve the oral health of your patients, do it with integrity, and run a business and have a team that feels that there's growth within your business. You are an Amazon bestseller author as well. You have two books, Grow Your Membership Plan, and this baby here,
Oh
which
yeah.
is, yes, that I send to my clients. I love it. I think it's the best textbook for learning how to do marketing from a dentist that's been there, done it. And you're a certified, this is another one, Kolbe trainer. I have personally experienced working with you and learning from you, doing the tests for myself and my team and my clients as well. And you are an expert in the science of ethical influence and persuasion. I'm going to repeat that one more time. You are an expert in the science of ethical influence and persuasion, which brings me to today's topic and the reason why I'm so thrilled to have you, because I want to ask you questions and I want people to ask us questions as you're joining us on the live, on the chat. But I have 5 specific questions for you. But before I jump into those questions, tell us who you are as a dentist, as a man. Tell us something fun that you enjoy to do before we jump into the business stuff.
Yeah. Good question. So this is my 20th year in clinical practice, which is kind of hard to believe. I know most of you are thinking I just got out of dental school, and so thank you for thinking that. But 20 years in the industry is kind of nuts. And so, you know, people often ask me, it's like, because you see that, I do a lot of stuff and I've done a lot of stuff. And one of the questions most people ask me is, how in the hell do you do all that? Right. And the truth of the matter is that I'm really, number one, I am good at juggling a lot of things at once, but I really am good at protecting my time more than anything, and really focusing all my efforts and energies on specific things at specific times and not multitasking. And so one of the things I've figured out, could when working hard is one thing, but you got to have a break. You got to have time for yourself and to recharge that battery that we call your brain. And while mine will go nonstop if I let it, I needed to figure out some outlet for myself to recharge. And believe it or not, I had to go back to my roots as a child. And so actually one of my favorite things to do is play video games.
Really interesting.
Yeah. And so it's just hard enough. So it
So
keeps
my son has hope.
yeah, and it keeps me focused on doing something, but it's not like stressful thinking or like complex thinking. So for me, it's very relaxing, and I feel like refreshed and whatnot. So in fact, probably after we get done today, I'm hopping online.
Nice. Look at that. So I just learned something new from you, and that's exciting and rewarding to hear that someone of your caliber likes to play video games, because I have a hard time with my son and trying to get him away from like devices. So
Yeah.
that's great. So the I have a couple of questions for you. You can elaborate more on any topic, because I do know that you have an important, like an amazing workshop coming up, and I want to make sure and encourage people to learn more about what they will be learning there. But I came up with a few questions precisely on the topic of persuasion and ethical influence in dentistry. Again, so the first question that I have for you is, what inspired you as a dentist to become and focus on this particular area of dental persuasion?
Yeah, great question. I like to think I'm a smart person, and I just magically figured all these things out organically on my own. But the reality is, I'm not that smart, and I get myself into all kinds of problems and all kinds of challenging situations as a result. As I often joke, because of my Colby, in the absence of problems to solve, I'm going to create problems for myself to solve. Not necessarily a good thing about my personality. But so I found myself, after having 4 fee-for-service practices around the Charlotte, North Carolina area, I sold my 2 best offices, the profitable ones, and I took over the 2 worst ones, the non-profitable ones, thinking
Oh, I
that,
think I lost him for a second there.
oh yeah, can you hear me now?
Yes.
Yes. So, it all kind of came about when I had sold my 2 best offices, the profitable ones, and I took over the 2 struggling worst practices, non-profitable ones, thinking that I could buy back my time and build it up and do more with the 2 than I did with the 4 offices.
Got it.
And so it was really more of a struggle, because once I did that, I had all these behavior issues with my patients, saying no to treatments, not only to myself, but also to my associate doctors in particular, was who was struggling the most. And so I also found that my team was struggling in the sense of, I kept having to tell them to get stuff done instead of, in my mind, figuring out a way to influence them to get stuff done, so they don't need me to keep micromanaging them, if you will. So, when you've got 4 offices and a whole other things to distract you, you kind of let certain things go. But, it was top of mind, pain, need, as we were bleeding, so to speak. And so I needed to know, what can I do to influence my team? What can I do to influence my patients? And how can I teach that to my associate doctors to do the same, so we could be successful? And because ultimately, I think our goal as dentists is that we're supposed to do no harm, right? We all took that oath when we graduated. But if a patient comes in with dental needs and they leave and they don't move forward with treatment for whatever the reason, then they're leaving in a worse oral health state. In essence,
100%.
we've done harm by allowing that to happen. And when there is something very easily we could do to change that outcome, if we really understood what people are actually using to make their decisions, right?
Got it.
And so that's what's kind of intrigued me the most. It was really, I heard Dr. Cialdini speak for the first time on these influence and persuasion principles, and I was like, holy crap, this guy's the expert. He has done all the behavioral science research. I don't have to guess anymore why people do what they do. He knows. So who better to learn from and to, to become one of my mentors and friends? I was very blessed to be able to have that opportunity. And now I'm licensed to speak on his behalf and talk about how I use these principles in my practices to solve the challenges and problems that I had, but it's the same problems I know everybody else has.
100%.
Right?
100%. Yes.
Mm.
This is so great. And now, oftentimes, and I said this earlier, like it hurts me deeply when I see really great dentists who really stand behind their work and really want to add value, but they don't have the skills, or they don't understand the patient behaviors that drive the decisions to accept or not accept treatment. So they do a disservice to the patients, as you said, when they walk away, and they also hurt their business. There are other dentists on the other side of the spectrums that I've personally experienced as a clinical dental assistant many, many years ago. I had a situation with a dentist that was very confident in speaking with the patients and getting them to do treatment. And where do you draw the line? And tell us a little bit more about balancing, for those that have this question, like, how aggressive do I need to be in order to close on a case? But at the same time, you want to have that balance between ethical, persuasion and growing your business. How do you manage that? And what, examples can you give us of how to do it ethically, keeping the patient's, oral health and benefit as a priority, but knowing that you also have a business and your team needs you to drive this business to be the vehicle for their own growth as well?
Yeah. Great question. From an ethical standpoint, it's fairly easy. If your true intent is to do what's best for that patient, right? Then I can tell you right now, you're not going to have to worry about crossing the ethical line. You're automatically going to be on the right side of this. But ultimately, the things that you're telling the patient, as long as they're true, not kind of true, not sort of true, right? Not semantically true, but true, right? Legitimately true, the whole truth, right? Not the half truth. If it's natural to the situation, again, you're not making up patient conditions. They're coming in with these things organically, right in front of you. And ultimately, if the patient chooses to move forward treatment, it would be a win-win for you both. Okay. Then objectively, you can feel confident you're on the objective side of the line, the ethical side of the line here. Okay. And from an objective standpoint, that's the problem with ethics, though, is it's a lot of it, if we're not careful, it's very subjective. That's why I
Yes.
call it your own personal code of ethics. It's up to you. So that's where that danger area lies. So we needed some objective criteria, and Dr. Cialdini laid those three things out for us. It's got to be true. It's got to be natural.
Mm.
And of course, it's got to be a win-win for for both sides. It can't just be a win for the patient. They got a
Yeah.
great deal at the expense of our business. At the same time, it shouldn't be a win for our business at the expense of the patient. And ultimately, if the patient says no or doesn't move forward with treatment and they get into a worse oral health state, we both lose in that scenario.
Got it.
We didn't get
100%.
to work and they leave worse. It's going to cost them more as a result. So it's got to be a win-win for us both. And by following those three rules alone, you're going to be on the ethical side of the line, which is good.
So it's got to be true, it's got to be natural, and it's got to be a win-win for everyone involved.
That's it.
Perfect.
Yep.
I'm going to ask you this question that it's a little bit off. This is something that happened to me in the dental office as a consultant a couple of years back. I had a dentist. She was into her business for about 1 year. And I came to the office. She said, treat me as a startup. I am really struggling with my practice. I made a lot of mistakes, and I need help, right? So I started to interview everyone in the team and overseeing some of the things that she was doing in the office. And something that caught my attention was we were having a meeting with the team and the dental assistant. I said, show me your recare and some of the patients that are scheduled and so on and so forth. And the dental assistant jumped into the conversation and said something to the extent, well, the patients are not coming back because she tries to do a work on when they're here because we don't have that many patients. What advice or tips do you have for a startup dentist that goes in and sits with a patient? They do need the treatment and they have the time and they want to get the patient to come in, but it's a new relationship. And how do you navigate this trying to fill the office, chair space, if you will, but in a way that you're not jeopardizing the trust with the patient, where your mind is like, my team is here and I have the time, this other patient rescheduled. Tell us a little bit more about what advice do you have for that kind of situation?
Yeah. So probably one of the biggest mistakes I see doctors making when they present any of the treatment needs to the patient is that they're assuming they know what the patient values.
This is key.
And that's a big mistake, right?
Mm,
You know, the old adage, what happens when you assume? You make an ass out of you and me, right?
yes,
So
yes.
instead, what I teach is to back that up before the patient ever gets to you and ask key questions, persuasive questions to not only get them in the right mindset to even want to be receptive to hearing what you want to talk about later at the chair, but at the same time, instead of us guessing what they value, they're going to tell us right up front. Okay. And we're going
Mm,
to tie our treatment recommendations back to those value statements. So, for instance, that would be a question on my questionnaire. If we find dental treatment that needs to be done, available, that needs to be done, is that something that you would prefer to get that done today while you're here? Or is it something that you need to schedule out over time? Because,
got it.
especially for me and you, we're similar in our Colby and the way we're built instinctively. But my wife, on the other hand, is completely opposite how I am in this one category called follow through. And some people are your same day people. They're perfect candidates for that because if I'm in your chair, my profile, if we're not doing it today, it's not getting done.
Yes, that's exactly. Yeah, we're both an 8 in initiative, right? Like on quick start.
Yeah. So like if I can't get it done literally today, I got 1,000 other things to do when I leave here. I'm not coming back more than likely. Versus my wife, if she's very structure oriented, she's very detailed and lives by the schedule. And in the absence of a schedule, she creates one, right?
Mm,
So if it wasn't on the schedule today, it's not happening. I don't care what influence principle you use. Okay. But the key here is instead of us guessing, let's just ask.
I
Then it
see.
takes all the pressure away because, oh, Mr. Jones, I see you're the type of person that likes to get this done today
Mm,
because I can't come back. Okay, well, here's what I see, and I've got time. Are you available? Let's do this. Right? So it makes the conversation a whole lot easier, and then takes the ethical dilemma away because now you're not pressuring people. You're not telling them, and the reason. And let's start with that. So how do you know if you're really using influence and persuasion versus the other side of the spectrum, the negative side, which is coercing people, intimidating,
mm,
making them feel like you're forcing them to do it or telling them to do it, right? And because influence and persuasion is the exact polar opposite of those things. It's nothing.
mm.
So, and our ethical line is right in the middle, right? So we know when we cross it, we are coercing, intimidating, and telling. And the way is that when you influence and persuade, it's all about offering patients choice. That's it. It's all about patient choice. The key is, though, we know what they value and we're framing the choices accordingly and appropriately
Framing. This is great.
and presenting it in a way that's going to guide them to the right answer. But now that they've picked and choosed it every step of the way, they're more committed. And you actually turn this dental need in our mind into a dental want in the patient's mind. And now it's a different ballgame because when they want it, it's not about the money, right?
That's true.
It's about, right? Can I do it today? Or when am I coming back to do it? They find a way to get it done.
This is great. So it's framing the patients and understanding the difference between influence and persuasion. And once you cross that line and you're just intimidating them or telling them about the treatment, and you recommend that they ask questions prior to the patients to sort of qualify it and see what they value mostly before they are actually sitting on your chair.
Yeah, I mean, think of it this way. Say you're sitting in the chair as a patient and the doctor comes to you and says, all right, Mrs. Jones, you need a crown. Okay. And they're telling you, right, what you need. And they're showing you the picture and everything else. Well, in the patient's mind, basically what they're thinking to themselves is, well, who are you to tell me I need a crown? Right? I'm in control of me. I'll decide when I need this crown. It doesn't hurt. I don't even know I needed something. So you know what? When you take somebody's control away, they're not
Yes.
only are they not going to say yes to you, they want to take the control back. And by doing nothing, they're taking the control back. Versus if you said, all right, Mr. Jones, you got a couple options. You can do nothing, but here's what's going to happen. And it's going to end up costing a root canal build up in a crown down the road and $3,600. Or if we get to it today, we can do this crown for a whole lot less. Which would you prefer?
I see. So you're just basically giving them options based on their needs and not telling them what they need, but more or less guiding them through the process and the choices.
Right. When you give people choices, they're in control.
They're in control. This is awesome. Now, you shared one common mistake, which is assuming that we understand what the patients value. Are there any common mistakes you also see when trying to persuade patients, and how can dentists avoid this?
Yeah, man, great question. So here's another big one, right? And it kind of goes something like this: the conversation between the doctor and the patient. Okay, Mrs. Jones, you can do this, you can do that, or you can do this other thing. So you can do this partial, you can do this bridge, or you can do this implant. Let me get the financial team to come in and go over those options with you, and you let me know what you want to do. And the doctor's out. So automatically, there were two critical mistakes made in that conversation. But it's a conversation I hear every dentist tell me when I ask them to present that kind of treatment to their patient, how they will present. Okay. So the first mistake was, again, going back to that choice thing, right? So the biggest mistake was they gave the patient too many options. So while we need some options, some choice to be in control, there's this paradox of choice, and that's a great book, by the way, by Ben Schwartz, that states that the more choices and options we have, the less likely we are to pick any of them.
Interesting. I should read that book.
Yeah, because the more options we have, patients lose the ability to differentiate the options. They can't tell them apart. They can't tell the differences. And so if there's any kind of uncertainty present, if they can't tell the difference, they don't move. It's safer to do nothing than pick. Okay. So that's a big mistake. We gave them too many choices. They didn't pick anything. And the second mistake we made was that, guess what? We just told the patient the sole number one thing they should use, the criteria to make the decision. When we said, let me get the financial team to go over the numbers and you decide what you want. We just told the patient it's about the price.
Got it.
Okay?
Got it.
So of course, patients aren't dental experts. They really don't understand their condition like we do. So they're looking for these things, these triggers, these principles, if you will, to help guide them to a decision. And here we just gave them the wrong one, make it about the price, and wonder why they made it about the price. Whoops, because we enforced it that way, right? We made it that way. So again, now I'm not saying that we're going to limit the choices for the patients. You can ethically present as many options as you feel like you need to the patient.
Got it.
You just can't leave them with all the options on the table. So what I teach in the presentation is how to funnel them down through this or that option choice we talked about earlier until the patient picks something.
Okay.
And truthfully, I don't care what they pick, because as long as they pick something, then they're leaving in better oral health than if they choose to do nothing.
That's great. I think that's true. So that's one of the biggest mistakes. Now, this is something that I wanted to understand personally, because I do have a lot of clients that have multiple specialties. Is this applicable? I know it's applicable because I'm learning. This is something that you can apply to any business, right? Like the art of influence and persuasion. But when it comes to dentistry as an industry or as a profession, are there any differences, say, for a dentist who is an orthodontist, that your patient is not necessarily the decision maker, or in a pediatric dental office setting? Does it apply the same way? Do you have any guidance or ideas on how to navigate that?
Yeah, absolutely. Because from a behavioral science standpoint, the top 5 reasons why people say no to you with any request you make them is universal. So the reasons they say no to us in general dentistry is the same reasons they say no to us in orthodontics or oral surgery or perio, as the same as they would if you were a salesperson in any industry, right? It really doesn't matter, because it's what people across the board use to make their decisions, to decide yes or no. So because there's 5 main reasons why they say no to us, it doesn't matter. It's all applicable.
Beautiful. Awesome. So we have, like, I usually do this within 24 minutes to 25 to 30 minutes. So we're going to be wrapping up shortly. What small assignment, or if there is one tip or tool that anyone watching the replay, and I asked earlier, but I personally, I don't know if I'm doing a good job at hosting this thing in terms of the follow through or answering questions, because it's a software that I don't really understand how to navigate so much. But if you guys do have any questions, while we have Dr. Phelps on the line, please let us know, write it in the comments, and I'll try to figure out how to retrieve it. I should have had Sylvia on the call with me because,
Yeah.
But what small assignment or homework can you give the doctors to immediately implement in their offices that that they can just as of tomorrow see an improvement?
Yeah. So I'll tell you what, I'm going to give you two things. Okay. So first goes back to what we alluded to earlier. Don't assume what the patient values. If you're not sure, ask. So if you can, I do this as a new patient questionnaire. So I ask all kinds of value and commitment questions before they ever get in front of us. My favorite being, when it comes to your oral health, do you prefer to be reactive when it comes to that, or proactive? Right? Because someone who's got a proactive mindset is now someone who's going to be sensitive to the consequences of doing nothing, and is now more likely than ever to say yes to something, right? Some treatment option. So ask better value questions. Do you want to do this today, or do you need to spread this out over time? Do you want to pay upfront in full for a small discount, or do you need to get fitted into your monthly budget? Let's don't dance around this issue. Let's just ask them. They'll tell you. Okay. So ask better questions. And if you can't get in your new patient form, at least interview them and ask these questions at the chair.
Ask these questions at the chair.
Awesome. Value, and then go back and tie your treatment stuff to that. The second bit I'll give you is that when you go to presenting, see, there was a third mistake that was made in that presentation of partial bridge implant. Okay. So too many options, told the patient it's about the money. But the third thing is this thing called contrast, right? Believe it or not, that's doing something what we call taking people up the stairs. So if you present options and treatment and each one gets more and more expensive in price, and you're taking them up the stairs, actually from the patient's mindset, each one sounds worse and worse and worse.
I see.
And they're less likely to do each one of those. Versus if you just did something simple by flip that, start with your biggest and best option first, and then go down in options from there, automatically you'll see significant increase in yeses in your treatment.
This is gold. This is amazing.
But on the same side, you'll actually get more yeses to everything else if they can't make the money work on the ideal thing. So again, more people leave with some treatment being completed than doing nothing. Beautiful.
And you're able to serve them better, and your team is going to appreciate that, and it's going to improve and help you grow your practice. So that there goes the win-win. Yep. Now, last question that I have for you. How can dentists learn more, work with you? Tell us a little bit about the services that you offer. Where can they find you? How can they work with you? And we can continue to work together.
Yeah. And probably an easy thing is you can find a lot of the stuff I do on �PhelpsInstitute.com. So just spell out �PhelpsInstitute.com. It's got a list of all the different courses I offer, from clinical, like such as implant training, all the way to this kind of topics like communication and marketing training, like the book talks about. So like, we've got a upcoming course in April for the Persuasion workshop, for instance. That's all listed on the website.
People can. I want to join you for that.
Yeah.
For that live session, because I personally think that I could benefit from learning this myself, and I want all of my clients and the people that are in my network. So if you are in the North Carolina area and you can attend this live workshop, by all means, I want to see you there. So let us know. Okay.
And it's great.
Post the link to the chat. Someone is asking. Hold on 1 second.
And if you can't be there in person, we are live streaming it. It will be recorded so people can watch it later. So
beautiful. So the PhelpsInstitute.com, right, Dr. Phelps?
That's it.
Let me see. I'm going to post the link here. You guys can join. Let me see. So someone said, can you post the link in the chat? If I didn't figure this out right now, I will make sure that I do it after the call. But yeah, so everyone that is watching, just a couple of, like to recap on what we learned today. If you know that you're delivering quality work and you want to continue to add value to your patients, to your team, to your family, and improve the quality of your life and the life of your patients, you want to be able to understand how we behave and how to influence them and persuade them ethically, and be able to have this natural win-win situation for everyone. So I encourage everyone watching to follow and look for Dr. Phelps' workshop, and whether you can attend live or virtually. If you have more than $5,000, $10,000 worth of treatment plans, and by all means, I speak to dentists all the time who are telling me, I just can't get patients to accept treatment. Learn from the best. Success leaves tracks, and he has taken the time to study this, and he's walked your shoes and has the same the same wishes that he has for his office and for his patients, that you should have also for yourself and for your patients as well. So learn from the best, and do not hold your business hostage by not investing in improving the areas that we are not taught, or you're not taught in dental school. And just the day-to-day grind and workload just doesn't give us the opportunity. So take the time off your schedule to do your due diligence, sign up for Dr. Phelps' workshop, whether it's live or attend the virtually. And I look forward to seeing many of you there. If you guys have any follow-up questions, let me know in the comments. Any last words, Dr. Phelps, before we wrap up and I'll let you go? I know you're busy. Thank you so much for this opportunity. I'm so honored.
Oh, you're welcome. No, that was very well said. And like I said, Dr. Phelps helps. So, this is a team training. It's not only just for the dentist, but it's for everyone in the office has a chance to influence and persuade patients in an ethical way, to solve the challenges that we all struggle with. So I encourage as many people that you can get in front of me as possible. Let me help you by influencing them to do more on your behalf.
100%. I will be there, and I'll make sure that a lot of my doctors join one way or another. Thank you again so much. God bless you. Best of luck and congratulations. And I really appreciate your time. It means a lot to me.
Thank you. Thanks.
Take care. Bye-bye. And we ended the broadcast.